very good afternoon. So we'll start our, I could say, dry practicals, because dry means there's no hands-on there. But I think whatever information we have later on will be very important when we have chance to do hands-on. So I purposely put some of the material there so that you can keep the material, and when times come, of course, you can always refer back and try to achieve some part of those guideline or even information that we use for today practicals. So the practical ones mainly will involve with, we got slide, and I have the guideline here, practical one, and then we follow up some of the actually PDF presentation of those slides. Then third one, we go to the case study, and final one, we go to the necropsy. But will be a short one. We might not be, I hope that we can finish within 1.5 or maybe 2 hours maximum. So the first one, this one is just for you to refer back, because I always mention about stratified squamous epithelium of the epithelial lining of the oral cavity and esophagus, but not been written in the lecture note. So I put there stratified squamous epithelium. Then the gastric mucosa, I mentioned this morning that they have a gastric pit and the gland, and of course containing of mucus secreting cell. I'll show you this morning those of the histology. We comprise of surface mucus cell and mucus neck cell. Both this is the mucus secreting cell, whether it is mucus surface or mucus neck cell. So they produce of mucus. And then the second one, they have a parietal cell. And this parietal cell is important with regard of production of hydrochloric acid. Keep the, what we call it, lumen or the stomach on acidic condition. So this acidic condition also play important role in process digestion, and even they play important role in the process of inactivation of microorganisms, for example, even viruses or bacteria. Because you look carefully when you understanding of the situation or environment of the stomach, which is acidic. For example, if you refer to live attenuated vaccine, live vaccine you use, particularly for those of envelope viruses. Those are the vaccine viruses that you put under what I call it oral cavities through oral route or through water. Sometimes might not be efficient because those of the virus might be inactivated when they reach the stomachs. So understanding the environment of the stomach is important. The acidic condition might not allow good viruses, let's say attenuated vaccine virus, to survive, and that might lead to what I call it, the efficacy of vaccination is not working very well. So that is important. In addition to, when there is imbalance between what I call it, hydrochloric acid produced by parietal cell and the production of mucus secreting cell that produce mucus, that also might lead to the environment of the stomach will change, alter, and might lead, if there more acidity, leading to erosion and might be ulceration. Similarly, also on pepsin secreting cell by the peptic cell. So this is 3 important cells that are only present in gastric mucosa. So that is something that you need to appreciate. And then with regard of particular changes, my highlighted here particularly is that when you examine a case, for example, you observe the animals, then after that, you might see some of the clinical signs. Like in this case, like foot and mouth disease, slide number 9 and 11, I'll show you later. The clinical sign is more of hypersalivation. Then when you open, the tongue is severely eroded, as well as ulcerated, present or hemorrhage, and inflamed. So we have to clear in terms of not that how severe is the ulcer, and then what more important thing that we have to think about how actually this ulcer develop. Then we call it pathogenesis. Or actually the ulcer develop is not sorry. Ulcer develop is not pathogenesis. As ulcer develop is mechanism of ulcer development. The mechanism of ulcer development. There are different between pathogenesis because pathogenesis is pathogenesis of a disease. For example, we mentioned just now, the pathogenesis will start from the agent. The agent will cause cellular changes, where it is lesion, then those lesions leading to what clinical sign, ultimately they cause death to the animal. So that is pathogenesis. But when it comes of mechanism of ulcer development, for example, they stop until development of ulcer. For example, in cases of foot mouth disease, the animal consume the virus, maybe through orally, then the virus will first enter the lymphoid organ, or in ruminant they appear patches in the GIT, or maybe up in the oral cavity, they will start to multiply. As a result of those multiplication, there will be primary viremia, meaning that the presence of virus in the blood circulation. And those virus will go targeted into the target cell. That in cases of FMD virus, the target cell actually is a stratum spinosum of the striated squamous epithelium, particularly in the oral cavity. Yeah, not really on the skin. Skin only on the hook, they are more susceptible. So meaning that we have primary viremia, then the virus travel in the blood circulation, they go in the blood circulation in the, what you call it, a tongue, go to the basement membrane, then they enter the what you call it, the stratum spinosum. When they enter the cytoplasm, virus is present in the cytoplasm. Then they multiply. When they multiply, they cause hydropic degeneration, meaning the cell gets swelling. And they further on those hydropic degeneration leading to rupture of the cell. And when single cell ruptured and more cell ruptured, the first thing they will accumulation of those fluid from the hydropic generation as a result of virus multiplication and accumulation of fluid, hydropic generation, then fluid will form a pocket. I mean, it is accumulated. And those accumulation, we call it as a vesicle. And then when vesicle get ruptured, get big and ruptured, then they lead to erosion. Only when it's severe enough, then the erosion go much deeper, they involve a basement membrane, so there will be formation of ulcer. So the mechanism of formation of ulcer will stop there. Yeah, mechanism, yeah. But we talk about pathogenesis because pathogenesis is pathogenesis of disease. They continue. When there's an ulcer, probably they may hemorrhage, but the hemorrhage may be not severe enough to cause death to the animals because it's only localized area. But maybe the cause of death, when you talk about pathogenesis, they most likely will invite secondary bacterial infection. And those ulceration also, animal might have dysphagia, meaning that they have poor appetite. But the poor appetite also are difficult to eat. They're not poor appetite, they are difficult to eat, sorry. Anorexia and dysphagia are different. Anorexia is poor appetite, but dysphagia is difficult to eat. So meaning they are difficult to eat, they cannot consume good food, and long run, maybe they are emaciated and so on and so forth. But that process of death is very long. It is sometimes is not that practical. The most, that's why we can foresee that sometimes in cases of MD, there are more chronic condition where, what you call it, the animal is still survive. They don't cause immediate death like other diseases like hemorrhagic septicemia. And normally animal will be, what you call it, slaughter, will be sacrificed, yeah, because people want to eradicate FMD. Why people want to eradicate FMD? because they involve with trade actually. The country that have a FMD positive might not able to sell their animals, particularly ruminants, everywhere. So they cannot export their products. So that's why they have to be free from FMD. And one way to prevent FMD to occur, what they need to do is that to sacrifice the animals by process of FMD by eradication. Although the animal still get alive, yeah, still alive. I mean, not immediate death as a result of FMD infection. But the most likely, if the animal going to die, when they have an ulcer there, so there's a tendency that there will be secondary bacterial infection. And the most common bacterial infection is E. coli, isn't it? So they will enter there, they multiply, then leading to septicemia, mean there will systemic infection. When the septicemia, what happened is generalized congestion of the organ because dilatation of blood vessel. As a result of that, there will poor venous return to the heart, leading to low cardiac output leading to ischemic necrosis of the vital organ, particularly the brain. And when hit the brain center, that leading to cardiovascular, respiratory, and central nervous system failure. Animal will die off. So that is the most possible mechanism of death if compared maybe with what we call it as starvation and so on and so forth. Otherwise, the animal may still survive for long because the lesion is not good enough without interference of secondary infection to cause death to the animals. Any question? Ada soalan tak? Any question?
No, Prof.
Tak ada ya? Okay. Kalau tak ada, it's fine. Then you can work out the second one. And you look there also, with regard of digital diagnosis. If you look back in your lecture note, you can see when animal has stomatitis. In this case, they have a erosive, ulcerative, and hemorrhagic stomatitis. Or normally in terms of classification of stomatitis, actually the animal have a erosive and ulcerative stomatitis, isn't it? So what disease can cause that is your differential diagnosis. So please remember that lesion associated with stomatitis got 5. One is catarrh, yeah. Second is a vesicle. Third is ulcerative, erosive and ulcerative. Fourth is the granulomatous lesion that we have in the animal. And the last one is the proliferative. So there is 5 lesions associated with stomatitis. So you can work out later on the others. Yeah? You can work into those slides. We have the slide and try to work out. Especially you try to answer those questions that is given to you. How good you are. You have to do your self-assessment. Yeah? Similarly, as tympani, those slides actually is available during lectures. Mycotic rheumatitis, homuncosis also they have. Then we got chronic gastritis, chronic ulcer, and stomatitis. Okay. And if you look carefully, I mean, this is not really when we have we might give a scenario. Like in this case, an adult cow with large mass in left jaw, cut surface of the bone, a white glistening, and multiple abscess observed within the bone structure. In this case, unfortunately, you are not able to describe the lesion and record the. You have a slide there later on, we'll show it to you for histological slide, and probably you can describe those of the lesion. Yeah, this is more on histological slide. The slide was captured on a very specific area that can describe this, what I call it, the histological slide. You need to do your, what I call it, assessment. And you got anything that you need my assistant, I'm most welcome to assist you. Okay. I finished with the one. Okay. And any question for this one? Ada ya? Okay. So I stop share, then I will share new one. Okay. So the next one, this is something is the slide itself. I don't know where is it. Hold on a second. It's here. I think I opened already, but they are not there. Okay. So we share on those of this one practical one. Okay. This what arise from those of the guideline that I give it to you. Okay. We move back. I mentioned to you just now. This is slide number 9 and 9. Yeah. See how the cow there. Please you follow you follow the schedule. Yeah, I have schedule is this. You can print and you have a look those questions and try to answer. Okay, this is the one. Remember, this one is something that I put a lot of emphasis during the lectures with regard of morphological diagnosis. Please try your best how you want to put a morphological diagnosis of this tongue. Okay, and then it's good. Pork virus infection. Then this is what I call it, vitamin A deficiency, hematoma, megaesophagus. You got rumen infection, blood, and others. So this one you do your best with regard of.
Prof.
Yes, please.
Sorry, Prof. I'm just asking. Are you sharing the slides? Because we can't see it. We can only see. Yeah, we can't see it.
Can you see the slide?
No, nampak doktor Prof tengah share slide
Oh, maybe lah. Hold on a second. Careful. I open already. Okay. I think sharing. Wait. Oh, you cannot see. Yeah, sorry. You are sharing Window Explorer. Okay. I haven't put the share. Maybe. Yeah. I'll try. Actually, I stopped sharing. How come I stop sharing? I think I share already. Hold on a second. Wait ya. Tak nampak ya? Hold on a second. Sorry for that. Are sharing now?
Yes, now we can see.
Okay. Oh, just now not sharing. Okay, sorry. Yeah, okay. And okay, can you see that? Can ya? So please refer to the what I call it, the guideline given to you. When you look at this slide, then after that try to answer. Okay. Because I mentioned just now, this is the first one regarding the question in note the severity of the ulcer. Describe briefly pathogenesis of disease. What is your differential diagnosis? Okay. So this and this slide. Okay. Then this is second slide, pork virus infection. You got the question there also for you to answer. Again, you do a self-assessment. But you want to submit to me your answer, you can also. But maybe what you need to submit later on, after this, we have a case study. Yeah. Okay. Then same thing with this one, vitamin A deficiency, hematoma, megaesophagus, rumen infection, blood, mycotic ruminatitis, we have hemorrhagic ruminatitis, homuncosis, and okay, stomach. These are all the stomach rupture, acidomycosis. This is based on the description, and this one the acinobacillosis. You can see those are the lesion there. Yeah, you try first, have a look, because the photo from the glass slide has been taken, captured. Just focus on those areas. Just for you to appreciate, don't worry so much, because I mentioned earlier, you are not going to be a pathologist, but when you look at the guideline, so try to appreciate what is there. Okay. Okay. This is a vitamin A, what I call it, metaplasia, where you can see that those are mucous cells, cell-fight squamous epithelium, that's been what I call it, replaced by a glandular cell. In the esophagus. This one. Okay. And this is a parasitic spastica. You remember the spastica lupi? There's those cases actually. You can see those on your right there. This is the parasite. And of course, this is granuloma involving the tissue response of the presence of those of the parasite. They might not cause much problem except for megaesophagus and probably reflux of the esophagus content into the oral cavity and might cause aspiration pneumonia. Okay. This one, the big one is Asparosca. And you can see grossly the parasite, and now when they cut under histological session. Okay, and this is how actually the eosinophilics or eosinophil respond to the affected area, lymphocyte cell. This is a mycotic hemomyositis. You can see those of the epithelial lining here, and those of the inflammatory cell of the abomasum. Yeah. And these are more of the close-up of the area. Okay, again, and you can see those are hyphae. This one center there is the fungus. Yeah, within those of necrotic cell. This is a more again gastric amebiasis. Again, the parasite there in the abomasum, cut surface, and the inflammatory response, particularly involving a lot of eosinophils. There. Okay. Any question? Can you do that? Hello, class.
Yes, Prof.
Can you? You try. But not worry so much. We just try. To me, it's for you to practice actually. Not worry so much because practice. I mentioned to you, you do your own self-assessment, meaning that when you look at it, how good you are actually. I'm not assessing you because fortunately we are not face to face, but you assess yourself because based on the guideline or schedule that given to you, you might able to get the answer. Okay. So that will done. Then we move to the. So I have to close this one. Yeah. We're setting for PowerPoint. Okay. I will stop sharing. Another important part now, we move to the second one. The third one. This third one is more on the, yes, I guess. Sorry, they are still the same. Hold on a second. Second, yeah, I'm not competent enough to. Now we go to the case study. Okay, I have this case study now. This is a case study. I'm not sharing to you. Wait, wait, video. Okay, can you see the slide, class?
Yes, Prof.
Okay, yeah, we can see here. So this is a case study. We have about 5 cases. Again, it's for you to practice. Partly I mentioned earlier, when you look at lesion, what type of question you have to ask. For this purpose, for the case study, I think it's good for you if you can do the exercise. You do a write-up answer and give it to me, and you submit to me by email or whatsoever. Then later we're going to discuss the answer and to see in terms of your self-assessment, actually how competent you are. This is very important because this is actually to reflect back whether you understand the subject or otherwise. And then you will reflect back in practice later on when you see a case. This is something that you need to practice. Meaning that like in this case, this one the one. For example, I think this has been discussed many times. Why I keep on repeating? Because to me, this is as a models. In life later on, you're going to see a lot of cases. And even later on your comprehensive examination, if you talk about exam, the examiner will ask you different type of question. But the foundation is that your ability to answer some of the key point of whatever lesion show to you. That's very important. The first thing, you must able to describe the lesion. I think this very clearly described during the lecture the other day. Yeah, meaning that you can see the epitheal lining slough off. You can see there is a reddening, which is hemorrhage. You thought a hemorrhage. You see there is swollen. You see that might be very painful. You see there's some reddening. So you thought it's more of inflammation, and the organ is tongue. So inflammation of tongue is glossitis. That's why you come up with morphological diagnosis. The morphological diagnosis, based on the severity, you thought is severe. Based on age, you thought is subacute. The lesion that you have there is an erosion, ulceration, hemorrhage, and inflammation, which is glossitis. Okay, the location, you can see that the location is at the apical part of our tongue, and the animal is a cow. So this is what I call it your morphological diagnosis. Describe the mechanism of lesion development. I think I repeated many times also. How, for example, when you have foot and mouth disease, enter, go to gut lymphoid tissue, primary viremia, go to stratified squamous epithelium, formation of vesicle, hydropic degeneration, formation of vesicle, then erosion and ulceration. That is lesion development. I think I discussed yesterday. But when it comes to pathogenesis, of course, they go further, where you have ulceration just now invite secondary bacterial infection, septicemia, low cardiac output, low venous return, low cardiac output, ischemic necrosis of vital organ, and then death of the animals. And describe the death is just reverse of the pathogenesis. Can you do that, my dear class? Okay.
Yes, Prof.
Yes, Prof.
Yeah.
Yes, Prof.
You practice. For you to practice, because when you start to practice, this is something that later on you're going to become a norm. Yeah? So because the important thing is that sometimes in our life, if you know what we don't know, it's okay. No, okay. If you know what we don't know, it's okay. But if we don't know what we don't know, that worse. Okay. Because you know you don't know, at least you time to work out to make sure that you cover. But if you don't know what you should know, so it's a problem. So I expecting you put as those 5 foundation for you to ask whenever you observe a case. Okay. So this is second one. Just to re-practice again. Same, you get this mechanism. Then of course, the fourth one is just additional 4 important type of lesion in the oral cavity. This is referring to stomatitis, where you have what you call it a 5 important lesion. Yeah, catral, vesicle, erosion and ulceration. Then you have what you call it granulentous and proliferative. Yeah? In this case, a combination of granulentous as well as proliferative. Okay. And then this, again, there are more of important lesion. This is an important lesion in this case. Describe pathophysiology, how actually development of blood. Yeah, that one we have later. Our next lecture, lecture 4, we cover on pathophysiology. And still, again, I still highlighted to you your ability to differentiate between postmortem change and condition or disease status in this case, because very important, because overextension can be a result of postmortem change. Your ability to differentiate between lesion and postmortem change. Okay, that is the objective of the question. Then this one, repeat again actually. But in this case, one of the additional number 3 there, although in FMD also about the same, but in this case, you say about potential sequences and complication of this case. Of course, in this case, they are more referring to perforation of the rumen, where there is perforation of the lumen, there's escape of rumen content in the peritoneal cavity, leading to peritonitis. And again, when we talk about peritonitis, animal septicemia, low venous return, low cardiac output, ischemic necrosis vital organ, and might lead death to to the patient or to the animal. That will answer number 4, cause of death. Okay. The question we repeated, the ideas of repeated is that to test how much you competence or comfortable with a situation when you are facing those type of cases. And finally, describe mechanism development, then pathogenesis of the disease. This more referring to the parasite. So we have this file. Probably I mentioned here that we might have a tutorial, or we might have give you the answer in our practical 3. Meaning that what we are trying to do, you can answer all those questions just a 5. Then practical 2, there will be another 5 questions. Then we'll discuss those answers during our practical 3 class. Yeah. And even in the practical 3 class, there will another 5 questions actually. But if you think still not comfortable with your competency, so then you can try again of those, the last question on the, I think hepatic, on the liver, yeah? There's another 5 questions. If you think not comfortable. If you're comfortable, if you feel that you want to just do one, question 1, the practical case study 1, you don't want do case study 2, you're okay. But I think it's good for you to practice to do 1 and 2. I will see if we got time, maybe we can give the answer also, the case study 1 in the practical 2, so that when you study, then you might able to better understand, and hopefully you give very better answer when you have answer for case study number 2. Question please. Ada soalan? Kelas, ada soalan tak? Are you okay?
Yes, okay, Prof.
Okay, yeah? Okay, thank you very much. Try to do, because I think this is very important. I mentioned to you is for you to develop a knowledge and competency. Yeah? Don't worry so much on the exam. You can answer all this. Of course, you have no problem with the exams, isn't it? Of course, as student, you have to worry with exam. I'm talking here is more towards practice. When you practice later on, and how you develop your skill and competence, although currently without hands-on. Yeah? Because by doing so, you got very good foundation. Because all the point given to you is a key point, and I hope that with that foundation, you will survive or you will be do good in whatever situation. So that is very important. Yeah. Okay. So now we move to the last slide. This is more longer than before because they look like lectures also, rather than just hold on, yeah. They look more like lectures. Oh, I don't know whether it's still the same. Okay. Oh. Wait, yeah. Where is the setting? I was still looking for the slide to share. Yeah, still the same one. Stop sharing. Second, yeah, I don't know why they want to share. Yeah, I think it's okay here. Okay, I have it with me now. Okay, so please bear with me. This one also, when I put necropsy and sampling technique in chickens, again, it is models, a very detailed approach of necropsy, not only focusing on GIT, but of course focusing on other, what you call it, organ as well. And I do believe that it might not be useful now, but probably you can keep the notes for future whenever you do or conduct necropsy, because I do believe it can be a very good line of what you should do when you conduct necropsy. And addition to that, you start to understand also when you receive results from necropsy, this is a type of guideline or question or things that you have to consider. Yeah. So that's why I put the necropsy and sampling technique in chicken. Actually, this part of the slide is used for training for veterinarian, we call it field veterinarian. There is practicing veterinarian in the chicken industry. But I want to share with you some of the important concept and principle. So I don't want to repeat again. This is what we call it most important one. In pathology, we have to understand definition of disease, pathogenesis, and diagnosis, where disease, adverse interaction between agent, host, and environment, leading formation, lesion, and clinical sign. Pathogenesis, agent get into the host, producing a lesion and clinical sign. While when you diagnosis, you look at history, clinical sign, lesion, and isolation or identification of the agent. So this is another repeated, but you have to, you look many times, you will appreciate better on. So diagnosis must be based, the whole process involve at least four, more important one, history, clinical sign, gross installation, and demonstration of the agent. But more importantly, in this case, this is a step of necropsy, okay? I will share with this, when this step, I was practice when I was student, when I was student, I practicing this. And I will keep that one to share with you all as well. Because in doing necropsy, they involve with planning. Number one and number three is planning, After you plan, then you do implementation, mean you do necropsy itself. Then what you need to do, you have to do evaluation. So when you plan, you must evaluate the case and case history. Based on the case and case history, you must able to come up with differential diagnosis. What I mean by differential diagnosis? What disease mostly involved in this case? List of diseases. If oral cavity, I mentioned you, they're all a list of diseases. And then before you open the carcass, you must able to list the expected lesion at postmortem. What type of expected lesion you expect to see during necropsy? And when I was student, actually, normally when you conduct necropsy, we're going to postmortem room in the late afternoon. Then after that, necropsy at 2 o'clock. We look at all this information. Then we open a book. Then we try to work out regarding the differential diagnosis, expected lesion, where we plan to do necropsy. These are the planning. After we have those information, because in this case you can read, but now also when you look at the history, you can Google or Google. But your ability to come up with differential diagnosis, of course, depending on your knowledge of diseases. If your knowledge is limited, then your differential diagnosis is less or more, depending. But if your knowledge of differential diagnosis is good, differential diagnosis can be less or be more also, depending. Meaning, if you say more, you're not good because you put everything. If you're good, you become less because you put only very specific thing. Okay? Then important to see what expected lesion, because in this case, after you know the differential diagnosis, then you know the target organ. So what type of lesion you expect to see. So when you conduct necropsy, you are more careful not to miss those, although not forgetting to do general examination. Then we need a technique. This is a skill that you have. You must know how to explore the lesion at postmortem. This is very important. In principle, as a vet student, you must know to open a case of ruminants because the technique all ruminant are same. Then the second one, you must able to open a case of a non-ruminants, like monogastric animal, dog, cats, equine. Then the third one will be in avian. But of course, more complicated, the fourth one, which is not really what you call it, we put a lot of emphasis. We talk about the exotic animals, like in cases of snakes, turtles, and many other things. So that is not been priority, but it's good you have chance to do during your what you call it 5 years program as DVM student. But the first three is very important. How to expose the lesion, and when you say that recognize and identify the lesion at postmortem. This is regarding your capability to differentiate between postmortem lesion, agonal changes, and lesion. So you must know lesion is always back to tissue response to injury, which is being categorized of 10 type of lesion. Only by doing that, you can have your evaluating the postmortem finding, your more physical diagnosis, the level of diagnosis there, what sample you need to send to the lab. Then after that, you might evaluate the laboratory results to obtain diagnosis. So this involves the word diagnosis there, meaning you will go back to the principle of diagnosis with the history, clinical sign, lesion, and agent. And finally, write reports. So this is something you need to do because when you conduct postmortem without report, it's not postmortem. So they need to do write a report. So usually the report is based on body system, and in common we have again 10 body system in our bodies. Any question? This general, but it's, to me it's very important. If not for now, maybe for later when you are in the postmortem room during your clinical rotation, DVM4 and DVM5. This is what we call it a planning, more detail there. Evaluating a case and history. For example, whether it is how significant is case. Meaning that how significant, for example, the case is only for example, one animal affected, less significant, isn't it? If the case is involved a flock of or herd of animals, it's more significant. It's a case involved with police reports, a crime, of course, more significant. You have to do carefully and get all the information recorded because it might involve with what you call it, the legal, and you might call you to come to the court to defense. So that's very important. Then accurate audiocy. Most of the time, please remember, when people submit a case, unfortunately, even when you have case from our hospital, UVH, the history is very minimum. People normally don't write a good history. Although you remember that when later on you're in clinical, you're going to train how to get a good history from the client. But many times we might receive what you call it the what you call it, history might not be written very well. But whatever history given, even the age as well as breed is important. So we have to take it and make use of it when you're making a diagnosis. And please remember, whatever history given, it is only a guide to you. Guide to you means that you take note. You don't have to take it in total, because in some instance, very rare but can happen. The patient, the person that submit the case to us, they don't give a right history because they try to, what you call it, avoid for certain things from being diagnosed, the cause of death. So we take note of the history, but we have to be more open-minded to look for beyond of the history given, yeah, so that you don't bias. Then you need to know and you able have a skill to do routine or specific necropsy. This is very important. Routine is routine. Specific means how you are going to open a brain, how you're going to open a spinal cord, yeah, how you're going to look into the eyes. There is a specific, not a routine examination. So you have to know also that the agency, individual, egg, site, and species. So please take note of that. Then list of differential diagnosis is referring to disease. List of expected lesion, when you look at expected lesion, you look into a body system. Body based on the lesion also. Body system got 10 body system. Lesion also get time. What you call it, 10 lesion. The skill you need when you want to open the carcass, you must have, one is a postmortem technique. You must be competent in doing postmortem technique, whether one is routine, and the second one is more on the specific. Routine is a routine, but specific, I mentioned to you, might involve examination of very specific system. Out of those 10 systems, yeah. For example, you talk about musculoskeletal, we have to do that. If you bought about lymphatic system, which is not routine. You talk about endocrine system. Endocrine system is not routine postmortem activities. But GIT, of course, GIT is a routine. So after exposure, you must able to recognize and identify the lesion. Based on gross anatomy, meaning that you're good in your gross anatomy of those 10 body system. And mentioned earlier, you must able to establish lesion versus postmortem change or angle change. And this is a guideline for you when you talk about description of a lesion or description of the anomalies. It's based on location, distribution, color, size, shape, consistency, severity, cut surface, smell, content of the whole. This is what I call it in terms of gross lesion. You should name the lesion, and finally, you must able to put your morphological diagnosis. Okay, so that one is step planning and implementation. And then evaluation, you have to evaluate the relationship between lesion and agent, then agent and relationship with this pathognomic lesion, then group specific based on whether bacteria or parasite, mixed group or non-specific. Non-specific, for example, congestion. And then you have to evaluate in terms of diagnosis, initial diagnosis, tentative diagnosis, and confirmatory diagnosis. This is an example of chicken. They have a 10 body system there, given. You can always refer. And this is an example when you do a necropsy in chicken, but which is also similar when you do necropsy, whether in ruminants or non-ruminants. If the animal is still alive, look at the clinical sign, general body condition, and nephropathic injury. In chicken, probably this one in pectoral muscle atrophy. Then you look at the mucous membranes, skin, and do those examination. Okay, this all is disease animals. I don't need to discuss about the disease, but you're interested, of course, I can only share today or later. Yeah. Then you need to do a external examination, so record the anomalies. You can collect sample if the animal is still alive. Yeah? In this case, you take swab. And then you can also, importantly, when you examine the organ, usually started from the cleanest area then to the dirtiest, meaning that the GIT is the final one. Although be careful, GIT can be the first one if based on your history, the most important organ involved is GIT, because GIT will undergo osteolysis very fast. That's why the history information that given to is important in your decision to make which body system you need to examine, first examine. Yeah. Then, of course, you get describe the abnormalities and your ability to come up with morphological diagnosis. And this, or when you open the carcass, of course, again, this is chicken, and examples. But when it's ruminants, of course, you got step to do open the carcass. When the monogastric animal, please remember, you have to fulfill the procedure as well. Okay? And then in this case, how you open there, you open the abdomen, cover the beak, and then you can see all the organ, the cavity, rectum is visible. Then examine all the internal organs in situ. And this necropsy also open the carcass. You start to remove all those organs. Everything is exposed. Then you start to examine and possibly need to collect a sample. Because you can see here, in this case, you can see the respiratory, urinary, digestive, reproductive, and basal organ all visible. So in this case, of course, they got hemorrhage there. The hemorrhage there is from capsule of the kidney of chicken, and this is due to the leukocytosome. Yeah? This case of leukocytosome. Then you might examine of each organ, yeah, or each organ, including what I call it. Okay, in this case, you see the kidney, you see the reproductive tracts, you see the adrenal gland, muscles, and you remove the heart and the lungs. And then you start to examine the sciatic nerve, joint, and bones, yeah? And also examine the brain. And we look at in this case, oral cavity, look at the nasal cavity, sinuses, nasocranial duct, and larynx. Then these are the lesion in the trachea or more respiratory system. And then you look also respiratory system, the lungs, the air sac. And of course, you see there's more granuloma is due to the fungal infection. And you look also lymphatic system. In this case, thymus. This one basal fabricus. And you examine GIT. I think you're quite familiar with this slide. I'll show you before. One external examination, internal tract, improving of those throughout the tract, which is locally from the oral cavity, esophagus, intestine, ceca, and the cloaca, large intestine. Okay, so after you examine, a few things we need to do, particularly on submission of sample. Okay, this is also some guideline we want to submit the sample. For histopathology, we need to fix the tissue in 10% buffered formalin. Why buffered? Because we want to avoid artifacts. Then we should not exceed 5 millimeter in thickness, and the volume of the tissue in relation to the buffer formalin is about at least 10 times the volume, meaning 1 part of the tissue, 10 part of the formalin, or 9 part of the formalin. So that is very important. We need to cut very small pieces because this is to avoid poor infiltration of formalin in the organ, and the organ might undergo autolysis. Yeah? That's why you need very thin. So this is something that is very important. Avoid crushing, even sometimes avoid to use scissors, yeah? Because that scissors might cause artifact because of compression. Care also to be taken, damage and destroy a mucociliary like the intestine. It's very easy, the epithelial lining being sloughed off. This is in terms of histopathology, meaning that we want to do histopathology examination. Histopathology is very important with regard to identify what actually the lesion occur in the organs. Then we might do isolation, identification, and characterization of agent. You need to collect and fresh tissue bacterial culture, viral isolation, toxicology for P cells and so forth. And this need to be packaged in clean or sterile containers, yeah, or maybe plastic bags. Remain cool and minimize possible of leaking. Importantly, you need to do also good labeling. Be sure to submit a complete information and form to accompany your sample. Sometimes this again, when it comes to history, even for submission of sample, sometimes the history also is not that very good being written. So we need to practice those good practice by giving very good, what I call it, history for whatever sample you submit to the laboratory. Then only you can evaluate laboratory result to obtain diagnosis, and you need to write a report based on the accepted format. I mentioned earlier, no necropsy is complete until all finding has been recorded in written form. This is important that we need to have a written form. Okay, this is regarding necropsy. I think I talked a lot just now regarding the ability to see in terms of postmortem change or maybe lesion, angular and artifact changes. Yeah. So I put here, you have lesion. You got 10 type of lesion there. Then you have postmortem change. You have about 14 types. It can be more of postmortem change. Then you got what mean by postmortem change. This changing, I think, due to the enzymatic activities, where there's autolysis, a postmortem change due to animal death, animal death, occurring and changes is not as a result of tissue response to injury. Agonal change is changes occur during process of death, and artifact is changes created due handling of the carcass or organs, or sometimes during processing when you talk about histology. And importantly also, which is not that commonly practiced, you have to note of ORE list of notifiable terrestrial and aquatic animal diseases, where in this case, actually we need to report to DVS whatever cases that we have identified. So now they have a single list of terminology and the agreement of World Trade Organization by classified disease specific given list diseases the same degree or important. That is quite, and this only for year 2017, the list included 116 animal diseases. If you got more information, you can always Google, look at this ORE, noticeable terrestrial and aquatic animal diseases. In chicken, these are some other examples. Some are example of these diseases on ORE list. Okay, thank you. Okay, Claire, any question? You have been so silent, ya? Ada soalan tak? Hello. Any question?
No from me, Prof.
No from you. So, ada yang lain ada tak? Ada question or not?
None from me also, Prof.
Okay. Kalau tak ada, so we stop here and you can do your work to proceed whatever question I raised to you. Boleh?
Boleh, Prof.
And Prof, boleh.
Okay, we finished much earlier. I thought what 3:30, but now it's only 3 o'clock. But don't worry. The rest I have tried to work hard, and I will see you again on Monday. We have lecture on Monday at 10 o'clock. We continue with pathophysiology and with intentional tracks. Yeah. Kalau tak ada, we end our practical here. You try.
I have a question.
Boleh.
Oh, sorry. I just wanted to confirm about yang Prof mentioned that we have to answer the questions tu kan?
Yes.
So we have to submit to Prof
Yes.
Oh, okay. Bila?
And this one of course if possible before next class lah. Before next practical. Maybe you can have on Monday at least. Can give me on Monday. So that before the next practical I have all those answer. Then I can foresee how much you're able to understand the lectures, you know. You get what I mean?
Prof. So this slide and also the other slide, is it?
No, you just do the case study.
Oh, okay, all right, okay. Thank you so much, Prof.
Only the case study. You have 5 questions there. You can put your answer in word also doesn't matter. But you put the question there and what is the answer, because to me it's just to see how much you understand actually, because you can understand the fundamental, particularly on the keyword that are given to you. I'm very happy with that. Okay.
Okay, Prof. Thank you so much.
Boleh I mean the case study one, you can submit by Monday, boleh so that I can have a look by Tuesday. Then we can maybe, if possible, if you have more time like today, you can go through those case study number 1 on what you call it on Wednesday afternoon during practical class. Go through one by one and we respond. You got any question? Then we follow up with improvement. You can do the case study number 2 where we can look at the answer for case study number 2 on our following weeks on Wednesday. Then after that, we complete. We have also a case study number 3, but you're still not happy, then you can test yourself with the case study number 3. Okay? Okay, class?
Okay, Prof.
Okay, Prof.
Boleh ya? Okay, good. Kalau okay, thank you very much. Have a good day.